Tēnā tātou katoa, good evening. If you get COVID-19, the time you have to stay at home isolating is about to get shorter. Your confinement will reduce from 10 days to 7 from midnight this Friday. It comes as pressure mounts on businesses and supply chains, with another 22,000 new cases today, bringing the total number of known active cases in the community to more than 200,000. There were 4 more deaths of people with COVID, 1 in Auckland, 1 in Tairāwhiti, Gisborne, and 2 in Lakes. And a third vaccine is now available for those waiting for the Novavax vaccine. A shipment of 250,000 doses has now arrived in New Zealand. Health correspondent Lucy Warhurst has the latest.
If you've done the time, you'll know how frustrating it can be.
10 days felt like a really long time. I think after 7, I was ready to get out and back into the world, back into going outside, going for a walk, back to work.
And from Saturday, cases and household contacts only have to isolate for 1 week, if you're symptom-free.
There is a balance here between making sure that we are continuing to keep the country functioning, whilst also doing everything that we can to reasonably turn down the level of risk that we're seeing.
We've all seen the impact of hundreds of thousands of people isolating. Michael Barnett wants isolation reduced even further.
It should be 5 days, not 7. But the biggest step they could do would be to allow everybody to be treated as a critical worker. Test daily. If you're free, go to work, because that's going to get business up and operating.
The health system has already had to adapt. It's been all hands on deck at Middlemore Hospital as 4 house surgeons were called in to bolster nurse numbers.
Well, the story of the doctors becoming nurses sounds great. It's not quite what it seems. We asked them to pitch in, add value where they could, because there's no black and white lines between a nurse's job and some of our younger doctor jobs, and that went extremely well.
Health workers who test positive for COVID can now return to work sooner. But the nurses' organisation is concerned workers will feel pressured to go to work when they're sick. Dr Connolly says they haven't yet called on sick staff and don't plan to.
We would not want anyone coming back if they don't feel well, and certainly when they do come back, they would do roles that protect their safety and well-being as well as our patients.
If you are symptomatic,
get the test and get the test result.
And register it, because the good news is if you've had COVID and someone else in your household gets it within 90 days, you don't have to isolate.
Well, Lucy joins us now. And Lucy, a third COVID-19 vaccine has become available, the Novavax vaccine. What can you tell us?
That's right, Mike. So anyone over 18 waiting for Novavax can book from tomorrow. It requires 2 doses, 3 weeks apart, but it can't yet be used as a booster. Now, Novavax is the alternative vaccine that some Kiwis have been waiting for. Chris Hipkins, however, says not many came through for wanting AstraZeneca, and so he's not sure how many people will actually want Novavax. I spoke with Thames Coromandel Mayor Sandra Gowdy earlier today. She famously said that she was waiting for Novavax, but she said people would have wanted it a year ago, but now the horse has bolted. So let's see.
Lucy, thank you.